Good morning, my lovely nurses. I hope you are fine and your family is good. So, today we will do multiple questions with rational and with full explanation. Our first question is: a client is admitted to the labor and delivery unit in active labor. During examination, the nurse notes a papular lesion on the perineum. Which initial action is most appropriate? Number 1, document the finding. Number B, report the findings to the doctor. Number C, prepare the client for cesarean section. Number D, continue primary care as prescribed. So patient came in the labor and delivery. Patient is in active labor. During examination, when nurse is examining the patient, that time nurse note patient have a lesion on the perineum, the papular lesion. So what is the initial action of the nurse? So our strategy point here is the initial action, the priority action, which one the nurse should have to take. So number A, document the finding. Number A is incorrect because the only documentation is not the proper statement, because this is not enough to document the finding, because patient have papular lesion. Papular lesion mean patient have the herpes lesion. Herpes lesion is not good for the patient during active labor. So the doctor should have to take a decision for the cesarean section, because if the patient have herpes lesion, the patient always go with the cesarean section, because there is a chances of the infection to spread to the fetus. So we will check accordingly. Number B, report the finding to the doctor. Yes, this is our correct option, report the finding to the doctor, because doctor has the right to make the decision, and doctor will check the patient and write the notes and order for the cesarean section or any further plans. That is the doctor code of ethics. He is the one, or she is the one, who will make the decision for the cesarean section. Number C, prepare the client for cesarean section. The nurse can prepare the client for cesarean section, but after the orders of the doctor. The nurse cannot take the decision by self. First doctor will check, doctor will write the orders, then the nurse should prepare the client for the cesarean section. Number D, continue primary care as prescribed. It is not enough to continue primary care, so the answer D is also incorrect. So our right option is number B, report the findings to the doctor, because clients with open lesions related to herpes are delivered by cesarean section, because there is a possibility of transmission of infection to the fetus with direct contact to the lesion. So this is very important, report to the findings to the doctor, so doctor further check the patient and make the decisions. Our next question is: a client with the diagnosis of HPV. HPV mean human papilloma virus. The infection is at risk for which of the following? So patient diagnosed with HPV, human papilloma virus. So which of the following is the risk for this HPV? Number 1, Hodgkin lymphoma. Number B, cervical cancer. Number C, multiple myeloma. Number D, ovarian cancer. So this human papilloma virus is at higher risk for cervical and vaginal cancer related to the sexual transmitted infection, the STI. So she is not at higher risk for the other cancers that mentioned in the A, C and D. So our right answer is B, cervical cancer. So cervical and vaginal cancer is the risk for the HPV, the human papilloma virus. Our next question is: during the initial interview, the client reports that she has a lesion on the perineum. Further investigations reveal a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is. So during the initial interview, the nurse is checking the patient. During the interview, the patient told to the nurse she has a lesion on the perineum. So the further, once the investigation done, there is a small blister on the vulva that is painful to touch. So nurse is aware that the most likely source is number A, syphilis. No, this is incorrect because the syphilis is a chunker. Chunker is a lesion actually that is associated with the syphilis. So is not painful. That lesion with the syphilis is not painful. So A is incorrect. Number B, herpes. Yes, herpes is the correct option because the lesion that is painful is most likely a herpetic lesion. Number C, gonorrhea. So gonorrhea does not present as a lesion. There is no lesion that is presented with the gonorrhea. So that is incorrect option. Number D, condylomata. Condylomata is the lesions are also painless warts. So D is also incorrect. So because in the question they mention the painful to touch, so most probably the painful lesions is related to herpes. So our correct answer is number B, herpes. Our next question is a 15-year-old primary gravida is admitted with the tentative diagnosis of HALP syndrome. Which laboratory findings is associated with HALP syndrome? So the HALP is HELLP. The H is for hemolysis, EL for elevated liver enzymes, LP for low platelet count. So in the question they said which laboratory findings is associated with this syndrome. So H mean hemolysis, EL for elevated liver enzymes, and LP for low platelet count. So we will check in these four options any option that is related to this. So number A, elevated blood glucose. No, elevated blood glucose is not related to HALP syndrome. So this is incorrect. Number B, elevated platelet count. This is also incorrect because there is a low platelet count in this syndrome. Number C, elevated creatinine clearance. Elevated creatinine is increase in the renal disease, not in the HALP syndrome. So this is not associated to this. So answer C is also incorrect. Number D, elevated hepatic enzymes. Yes, this is our correct option because as I told you, in the HALP, EL mean elevated hepatic enzymes. So our correct option is D. Our next question is the nurse is assessing a deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the biceps reflex? So the nurse is assessing a preeclamptic patient. She want to check the deep tendon reflexes of the client. So which method she will use to elicit the biceps reflex? So what is biceps reflex? Biceps reflex actually is a deep tendon reflex test, also known as a muscle stretch reflex test, that examine the function of the C5 reflex arc and the C6 reflex arc. The test is performed by using a tendon hammer to quickly depress the biceps brachii tendon as it passes through the cubital fossa. So this biceps is a tendon reflex. We also tell this muscle stretch reflex test, and mostly we are examining the function of the C5 reflex and the C6 reflex arc. This test we are mostly performing using a tendon hammer to quickly depress the biceps, the brachii in the antecubital fossa. So muscles insert in the antecubital space and taps the thumb briskly with the reflex hammer. So we will check which option is related to this question. Number A, the nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. Yes, this is our correct option because the nurse put the thumb on the muscle inside the antecubital space and taps the thumb briskly with the reflex hammer. As I told you, the test is performed by using a tendon hammer to quickly depress the biceps brachii tendon as it passes through the cubital fossa. So this A is our right answer to elicit the biceps reflex. Number B, the nurse loosely suspend the client arm in an open hand while tapping the back of the client's elbow. This is incorrect option because that is tricep reflex. Number C, the nurse instructs the client to dangle her legs as the nurse strikes the area below the patella with the blunt side of the reflex hammer. No, this is also incorrect because that is patella reflex. Number D, the nurse instructs the client to place her arms loosely and at her side as the nurse strikes the muscle insert just above the wrist. So this is also incorrect because that she is checking the radial nerve. So our right answer is A. Our next question is, a primary gravida with diabetes is admitted to the labor and delivery unit at 34 weeks gestation. Which doctor order should the nurse question? The patient is diabetic, primary gravida, and admitted in the delivery unit at 34 weeks gestation. So which doctor's order should the nurse question? Which doctor, which of the order that the doctor put wrong, I'm sorry. So the nurse should have to question with the doctor about that order. Number A, magnesium sulfate 4 gram 25% IV. That is our incorrect option because that is correct statement. Magnesium sulfate we are using in the gestational diabetes patient. That is the good for the blood sugar and the insulin. Number B, brethine 10 microgram IV. This is our correct option because that order she put wrong. The brethine is used cautiously because it raises the blood glucose level. So the nurse should have to make question with the doctor. Number C, Stadol 1 milligram IV push every 4 hours as needed PRN for pain. Yes, Stadol we are using in the pregnancy because this is the relief of the labor and the delivery pain. Number D, Ansef 2 milligram IV PBP every 6 hours. The Ansef is an antibiotic that we are using IV. So this one also we can use it during pregnancy, is safe. So bethine 10 microgram, that is not good for the patient. We are using very cautiously because it will raise the blood sugar level and patient is already diabetes. So we should have to make a question with the doctor. So she can check again and change or replace with some other drug. Our next question is, a diabetic multigravida is scheduled for an aminocentesis at 32 weeks gestation to determine the LS ratio. L means the lecithin and the S means sphingomyelin ratio. Actually this LS ratio we are using to the traditional standard for fetal lung maturity testing. So this test we are checking to check the fetal lung maturity testing. So and this LS ratio and phosphatidyl glycerol level, the LS ratio is 1:1 and the presence of phosphatidyl glycerol is noted. The nurse assessment of this data is, so the result of the LS ratio is 1:1. So the nurse assessment of this data is, the nurse should have to assess this 1:1 ratio. What is showing this 1:1 ratio, what's the problem the child have. So the normal LS ratio is 2:1. If the 2:1 ratio is, it means the lungs are considered to be mature. So we will check because 1:1 LS ratio is not good. So we will check which option is related to this result. So number A, the infant is at low risk of congenital anomaly. So this is our incorrect option because as I told you, the LS ratio we are checking, we are doing to check the lung maturity of the fetus. So this is not related to congenital anomaly. So this is incorrect. Number B, the infant is at risk for intrauterine growth retardation. This is also incorrect option because this is not showing the intrauterine growth retardation. So B is incorrect. Number C, the infant is at high risk of respiratory distress syndrome. Yes, this is our correct option because we are checking the lung maturity of the patient. So 1:1 is not a good result. As I told you, the 2:1 is showing the mature lung of the fetus. So 1:1 is bad result. So infant is at the high risk of respiratory distress syndrome. Number D, the infant is at high risk of birth trauma. So this is not related to birth trauma. So D is also an incorrect option. Our last question is, which observation in the newborn of a diabetic mother would require immediate nursing intervention? Number 1, crying, wakefulness, jitteriness, yawning. So patient is diabetic mother, the newborn of the diabetic mother, which intervention is immediate intervention required. So number A, crying. It's okay, the children are crying after birth, it's a normal thing, so A is incorrect. Number B, wakefulness, this is good, this is also incorrect. Number C, jitteriness, yes, this is our correct option because jitteriness is a sign of seizure in the neonate. Number D, yawning, this is also incorrect. So crying, wakefulness and yawning are expected in the newborn. So answer A, B and D is wrong. Our correct answer is C, jitteriness. I hope you like the lecture. If you like, please share and subscribe my YouTube channel. And don't forget to push the icon bell button so you can receive my coming videos notification. Thank you very much. Take care yourself and your family. Allah Hafiz.